Burt Reynolds did it, so did Faye Dunaway, and Joan Rivers does it on a regular basis.
But on tonight's Mixed Plate, we see the no-knife alternative to the facelift.
What's the #1 cause of wrinkles? The sun? A poor diet? While those are factors in aging, the primary culprit is gravity. And unless you live in outer space, this law of nature is bound to cause changes on your face. More than 100,000 rhytidectomies or facelifts were performed in the U.S. last year. And that may seem a lot, but the number is decreasing because women and men are finding non-surgical alternatives.
I really just wanted to have a little bit of a tightening, not a drastic explosion of a facelift.
So the procedure she's chosen is called Refirm, which uses bipolar radio frequency and infrared light. A conducting gel is swabbed on the face, then the Refirm light gun targets the areas of sagging skin.
It bulks heat into the skin. It helps stimulate by building new collagen to the skin. Also, the collagen that's already existing in the skin, basically it tightens that as well. So it gives that an immediate tightening.
Refirm is one of the so-called lunchtime procedures. Walk in, walk out, no cuts, no bandages, no bruises.
And it takes about half an hour to 45 minutes. There's no downtime. You can immediately go back to work.
But what Marilyn likes best is that nothing is being cut away or put into her skin. The Refirm process is said to stimulate your own system to boost collagen production.
Many people came up to me and said, something's different. And I said, well, my natural collagen is working for me. That's a nice way to put it.
6 to 8 treatments are typical. Aesthetica's Refirm is about $450 a session, a fraction of the $10,000 Marilyn would pay for a surgical facelift. Tomorrow, got the Botox blues? A new technique helps your body fill in those facial pukas. That's Mixed Plate. As you age, the muscles weaken under your lower lids, the skin thins, and fat finds a resting place in those pockets commonly referred to as bags under the eyes. But that's a misnomer.
This area, the so-called nasojugular tear trough area, some people think they have a bag, but actually don't. They have a groove.
58-year-old Janice Sensenig not only had troughs, they were deepening and turning dark, but the operating room was not for her.
I had facial surgery many, many years ago, and I don't want to really repeat the surgery. So I would like a more temporary fix that I know may last a year or two, and I may have to touch it up, but I won't have to go under the knife.
So she'll settle for a poke of Sculptra.
This material is a polylactic acid. It's a perfectly natural material, and it's just a polymer of that.
Sculptra was originally approved by the FDA for HIV patients who experienced severe skin thinning. Unlike Botox, which fills in the depressed area, Sculptra in tiny amounts sets off a reaction.
It irritates a little bit, and that's what leads to collagen formation and thickening of the area.
The patient plays an important part. Janice has homework.
You can gently massage. We just use like 2 fingers in kind of a circular motion. And then, massage it every day for a few days. And then after that, you just leave it alone. So you do have to wait a little while to see the result, but it's really well worth it.
Dr. Capity says 3 treatments lasts up to 4 years, sparing Janice another trip to the operating table. That's Mixed Plate.